Hi, I'm Dr. P.K. Talwar, cosmetic surgeon, New Delhi, and I'm practicing cosmetic surgery for more than 30 years now. Previously, I was attached to Apollo and Max hospitals, and now I'm running my own cosmetic laser surgery center at Greater Kailash Part 1, New Delhi. We are getting a lot of queries about non-surgical rhinoplasty. This is the term that is more and more used, and more people want to undergo anything which is non-surgical just to improve their looks. So the rhinoplasty has also got some components which can be improved by non-surgical methods. So that is the non-surgical rhinoplasty. And whenever we talk of non-surgical rhinoplasty or any non-surgical procedures, the two things are very common. One is threads and another is fillers. Now see, threads have got their own utility, their own use. Now if these threads are basically, we are using PDO threads, cork threads, there are so many threads have come, there are so many varieties have come. But you have to understand basically that these threads are used, either we can use them for augmenting the dorsum, we put multiple threads here in the dorsum through a puncture here, or that is to augment the dorsum, or if you want that the tip which is drooping, it should be fixed like that. So again we use these barbed threads, we put it inside and we fix the tip in the shape which we want. We can lift up the tips also in the desired shape by putting the threads in those direction and then lifting it up and fixing the threads in that position. Now these threads have got limitations. Limitations is that yes, they are not very long lasting. They may last say for 6 months, 1 year or 1.5 years at the most practically, and you have to undergo the procedure again. Second thing is filler. Fillers can be used. See, the name filler means you are filling something. So if there is any irregularity, you can fill that up. So if there is any irregularity on your nose, dorsum, like you say in my, I've got a hump. So if I want to remove the hump, what we can do, we can put a filler here so that it will give a straight line like this. So that will improve my looks without undergoing any surgery, because the depression above the hump has been filled. So it is filling something, some defect. If your nose has got some irregularity, you can again fill that gap, fill that irregularity, and it will become a very smooth nose. You can give tip projection also. The tip is not projected, we can give soft filler here so that it projects. You can say the shadow of the domes is there and you feel that your tip has been lifted up. So that is by method of fillers which we are using it. Now sometimes see, you have got deviated nasal septum also and you don't want any surgery. You say no, my breathing is okay, just you want to give a straightened shape. So what we can do, we can balance it by giving the filler on the other side and give you a straighter look of that. So these are few techniques. Threads, by way of threads, we fix the tissues in the desired shape, or we fill up the gaps, deformities, any depressions, or we project the tip in desired methods. So these are all non-surgical techniques which can be used in office setup also. So because we are using them in the office setup, they are known as non-surgical methods, so non-surgical rhinoplasty. So this is a basic introduction I wanted to give you about non-surgical rhinoplasty. I think long time back we had given a video also on that. The fillers were used to change the shape of the nose. So regarding this, if you got any further queries, any questions, any doubts, please feel free to ask our team and we'll be very happy to answer any of your questions. And if you like the video, please don't forget to subscribe it. Thank you very much.